Okay, great. So we're going to get started. Thank you all and good afternoon. We're really excited to present this webinar today on working together, how colleges and universities and community organizations collaborate to address sexual violence. A quick logistical note before we begin, all participants except our presenters are muted. If you have questions or comments, please use the chat box on the left-hand corner of your screen, and I will be happy to answer them for you. There is a question and answer session at the end of the webinar when all of our presenters will be able to answer your questions. So throughout the webinar, please feel free to send those questions on to me using the chat function, and I will share them with the presenters at the end. Okay. So today's webinar is the result of a partnership between the New York State Coalition Against Sexual Assault, the New York City Alliance Against Sexual Assault, the Commission on Independent Colleges and Universities in New York, and the New York State Department of Health. Before we get started and before we introduce our presenters, I'd like to take a quick moment to figure out who is in the room with us. So we have a quick survey. If you could complete it, let us know who you are. If you're a Rape Crisis Center advocate, a Title IX coordinator, a member of law enforcement, a university administrator, or other, please select who you are. And this will be completely anonymous. This is just for my own information. So I'll give everyone a couple more minutes. It looks like we got most of our responses. Thank you so much. So now we'll get started. Okay. So today we are going to hear from 4 advocates regarding how they are collaborating with colleges in their area to meet the needs of college students. Our advocates are going to share innovative programming as well as solutions for building and strengthening partnerships within their colleges. So please note that this webinar, is going to be recorded and it will be shared tomorrow. So at the core of some of the partnerships and programming that our presenters are going to share with you today is a signed or in the process of being signed Memorandum of Understanding between a university and a rape crisis program. So on MOUs, the Department of Health has provided us with the following guidance. The Department of Health strongly recommends that programs have an MOU or other written agreement with colleges for their Enough is Enough programming. An MOU is considered best practice as it is a formal agreement between 2 or more parties to establish an official partnership and provides the expectations for both parties. If a college has not yet signed a formal MOU, agencies should continue to work with colleges to provide services and prevention education awareness for their college population. So for questions and assistance with MOUs or building partnerships or any other questions that you may have regarding the work that you're doing with college populations and through your EIE programming, you can connect with the New York State Coalition Against Sexual Assault or the New York City Alliance. Up here I have the contact information of Chrys Ballerano at NYSCASA, and I have Nastia Gorodilova with the New York City Alliance Against Sexual Assault. Okay, so let's dive in with our first presenter, Chrys Valeriano, who is the Director of Collaborative and Holistic Services and Resources at the New York State Coalition Against Sexual Assault. Chrys, it's all you.
Thanks so much, Michelle. Hello, everybody. I'm so glad to be able to join you today for this. Collaboration is one of the favorite things I get to do here at NYSCASA with a number of different projects that I co-lead on. And the the piece that I'm going to share with you, I've really borrowed a lot from an article that Margaret S. Herman wrote, or edited actually, a long time ago. And the name of the article is Communities Working Collaboratively for a Change. It was found in a publication called Resolving Conflict, Strategies for Local Government. And it was something that I used early on in my time here at NYSCASA with my Working Together project, which was called Sexual Assault Mental Health Project. We now call it Building Connections, and some of you have heard of it. So I'm going to borrow from this article to share with you really the concept of how collaboration defined is a developmental continuum of change strategies. It's not something that we often just dive into and be able to do well. It takes time. It's a continuum, much like there's a continuum of prevention strategies. There's also a continuum of sexual violence we've talked about in our work. There's also a continuum of collaboration. So the first stage, as you'll see in the slide, is really defining what our goals are and who we want to partner with to achieve those goals. So, it's important to clarify our terminology so that we don't, sometimes people are off-put if we say, oh, I really want to collaborate with you, and you've just met them. They may understand from experience that collaboration takes a while. So they might be even off-put by you, presuming that you can do that with them. So using the kind of terminology that's going to put people at ease and say, hey, I'd really like to know more about what you're doing on the campus, how you're engaging students, like using terms that really are clear is helpful, and it will help us to enhance our practices. Can I have the next slide? So the first stage really is very informal. It's really networking. It's showing up with our business cards, maybe our agency brochures, or whatever it is that we use when we want to make a good first impression, right? And so it's very introductory. It's pretty basic. It's like basically identifying who you are, what your role is, what your goals are from the project that you represent, and finding out more about them, finding out like, whoa, geez, we have some common goals here. Isn't this interesting? Maybe we can stay in touch. And it's a pretty simple, quick contact. Next slide, please. Then we move into, if we do identify this person is open to this relationship and open to these common goals that we seem to have identified right off. So we really want to find out more. We want to learn more about what their responsibilities are, what their organization is like, how it's structured, and it definitely involves a lot more conversation and communication. So we've really now we're starting to invest some time. We're starting to really plan our conversations a little bit more, and this is where we need to make sure we really give adequate attention to the process, because a lot of times if we don't take enough time in this stage, we run into roadblocks later, and we don't want that. We don't want to create more barriers to meeting the goals that we've identified that we share. So it's tricky to do sometimes, particularly if we don't have a lot of face-to-face contact. And so even establishing like what are the best ways that to communicate with this individual or this institution. Do they prefer that we email? Do they prefer that we call? Do they prefer face-to-face contact? How frequently can we do that? By doing that kind of checking in about what each other's roles are and what each other's responsibilities and outside of this particular goal might be, we have a better understanding of how to meet those needs. And also we start to develop a level of trust. We start to understand each other's work style. We start to be able to really develop a relationship, a professional relationship. And that is really critical as we move forward, because the only way that we can build upon working together is by having a sense of trust and having a sense of respect in the relationship, much like any of the things we teach about primary prevention, right? We want to make sure that there is a healthy relationship in place, and that's really the bulk of the coordinating work, is getting to know each other and our working styles. So if we do this well enough, the next stage, with the next slide please, is where we really begin to find ways we can cooperate, where we can find ways that, not only are we, both interested in creating a safe environment, but we also have these resources that we can really share with each other. And we have contacts to other organizations that have given us, permission to share these resources. So we really start to enhance each other's work. We even get to alter what we might do. So giving like examples, initially we might have just, gone to an event and shared a card with the Title IX coordinator. The second time we might have gone to the campus, we might have, not only met the Title IX coordinator, but might have, met other folks on the campus who are engaging with students and recognize us now as a go-to person who has some expertise in this area. Now we're starting to maybe think about co-sponsoring events or trainings and sharing our expertise in a much more public way. We're cooperating to really develop a program. And this is where, the more in-depth we work together, the more we want to protect the work that we're doing by suggesting that, having a written record of this, having documentation of this kind of relationship we're developing is really protective of both the organizations, or all the organizations I should say, and partners involved. Because in this time, we know that folks leave their jobs for other positions. Sometimes they may even leave the institution completely. And when we get to the stage of cooperation where we really are beginning to do some very valuable work, we've invested resources. We've invested our human, our financial, our technical resources, and our expertise. We've shared staff. We've shared property. We've even shared sometimes, our other colleagues that we've brought in from the outside. And we want to try to build upon this. We don't want this to be a flash in the pan kind of project. We want this to be something that has sustainability. And so by having some kind of documentation of this relationship, whether it be a written agreement, an MOU, or some kind of formal contract, we protect it for the future so that if somebody else steps into that role the next semester, they have a place that they can spring from with you. They have some background. You don't have to reinvent the full wheel with them. You can actually keep it rolling, which is really what we want to do in this work, particularly when we're engaged with students. We know that student turnover is super high, and so if we're going to be working with students, which we are, I think we want to encourage and include front and center student leaders in this work. We need to try to document, and that's sometimes easier said than done. But I think the longer we stick at it, we stay in this work, developing these relationships, the more likely those written agreements will really reflect the work, and the next students who come in will be able to keep moving forward with the goals. Of course, this does require a high level of trust, and it also, it takes time before that happens. It's not going to happen in one semester or even 1 year. Can I have the next slide, please? Ultimately, the goal is that we're not going to just be exchanging information and changing our activities and resources, but we're really going to be building our capacity for both the the training TA rape crisis programs or whoever might be coming in from the outside, as well as the capacity of the institution, which they feed each other. I think advocates learn from students all the time. Students learn from advocates. We learn from law enforcement. Law enforcement learns from the responses of survivors. The Title IX folks are doing their best to represent all the parties that need to be fairly served. And I think that all of this is so, sometimes there's so many nuances that we cannot possibly just jump into a collaboration partnership here. We need to step back sometimes, and if things become challenging, we step back and say, okay, where did I maybe drop the ball in the coordination department? Where could I have done a better job of following through with that other department that now is feeling like they got left out? So how can I repair that? And so sometimes it's really admitting our own vulnerability, that maybe we're stretched thinly, we've got a lot of campuses we're engaging with, and we want to really develop trust and acknowledge if we do make an error that we can go back and we can rebuild from that other stage. We may not have a collaborative relationship with everybody we want right off the bat. It's going to require a little more trust building. And so sometimes we do have to take a few steps back in order to really share common turf with each other. So with that said, I'm not suggesting at all that this work is easy, but I am fully of the belief that this is extremely exciting work and highly possible to move out campuses to a much more safe cultural experience for all students. And I really acknowledge everybody doing this work, because I know most of you already know this, but it's just a reminder that we can't do this alone, that all of this work ultimately is collaborative work. If you have questions for me, as Michelle stated, I'm more than happy to talk about the work that I do. We've included some additional slides here. I'm not going to talk about them all, but ultimately collaboration is always for betterment. It's always to improve and empower folks in their environments. And I'm happy to talk with you about how my positions here at NYSCASA over the 17 years I've been here have involved all different levels of collaboration and some of the things I've learned from those experiences. I'd be happy to talk with people on a one-on-one or in a group call at some future date.
Okay, thank you, Chrys. And before I introduce our next speaker, just two reminders. First, please make sure that you are muted, especially our presenters. We don't want any background noise. And then secondly, please make sure to send in your questions via the chat function. We've already received a few, but we have about 10-15 minutes at the end of the presentation to go through those questions, so please don't hesitate to send them along. Okay, great. So I'd like to introduce our next speaker, Angelica Soto, who is the campus advocate with Renewal House. Angelica, can you unmute yourself?
Yes.
Perfect. All right, it's all you.
Okay. Hello, everybody. I'm so happy to be joining you today. So we're kind of going to be piggybacking on what Chrys was just talking about. Where I'm coming from is specifically as an advocate for a local center that works on all of the college campuses. The 4 campuses in our area have been gracious enough to give us a space, so I'm on each of the campuses 1 day a week. So just so you know, going forward, that's kind of what I'm doing right now. In the past, I have worked in higher education. I worked as an administrator. So that gives me a little bit of a different view of working with the campuses. And just like a good college class, today I will be posing a lot of questions, but because of time constraints, we may not be able to get into all of the issues or all of the discussion that I would like. All right, so our first slide here. All right, so 129B, I'm not going to go into this too much, but I did want to highlight this for a reason. So in terms of some of the community organizations working with the colleges, you know, the portion that says to provide services and resources to students, while on a space that seems pretty straightforward, it leaves a lot of room for interpretation to both the community agencies and to institutions. So what we're going to get into next is just some of the factors we may need to consider when working with institutions as community organizations and advocates, and why some of your work with different campuses may look different. There may be different approaches, you know, as we go through some of the questions. I think you'll kind of begin to see why all of those relationships may look so different. All right, next slide. All right, so some of the things to consider. So campus culture. When working with our college campuses, it's a really good idea to approach it from, an anthropological or a sociological perspective. So really taking the time to study what the values, goals, beliefs, and practices are on that particular campus. Right now I work with several different types of campuses. Some of them are very focused on the STEM, engineering. And then I have other schools that I work with that are more of vocational schools. So the student populations, the institutions themselves, very different needs for a commuter versus a residential campus. All right, complaints. So have the institutions that you're working with had Title IX or OCR complaints filed? This might help you understand what their needs are at the moment. Dedicated staff. So do they have a person or people on campus whose sole job it is to coordinate some of this work? Do they have their own campus advocate or community educator? This is going to further inform how we work with them. For some of the campuses who have somebody whose sole job is working on this, you might be going in and they already have a really robust infrastructure. So they may not need some of the things that you're offering to the other schools. Maybe somebody who's part-time may need a little bit more help, right? Maybe they need some more presentations from your organization. And none of this is to say that one is better than the other. Different campuses have different resources and different reasons for dedicating staff or splitting up those duties. So experience. So when you're working with some of the administration, the staff, the students, and some of this goes back to culture as well, take into consideration, are you working with somebody who has been doing this work for years and years, somebody who's relatively new to the position, somebody who's relatively new to this work? Because it may look very, very different and you may need to approach it differently. Somebody who has a lot of experience, you may not need to go through some of that learning curve of just the different programs available or the lingo. Institutional memory. So what has the school's experience been working with community organizations in the past, or working with other, grant-funded initiatives? There might be some history there that you need to tap into, whether that be because you're receiving a really positive response, or whether that's because the school is maybe a little hesitant with the connection. Was there a bad experience in the past? Are they worrying about the continuity of service, after the grant funding might go away? Liability, I don't think I need to say too much about that. We have and kind of continue to live in a very litigious society. So maybe the school's worried about, somebody working with the students or working with the campus who they have no institutional oversight with. Reports. Is the school getting a lot of reports? Are they not getting a lot of reports? And then space. If your goal is to be on campus, do they have the physical space to do that? Are they going through a growth period where there's kind of a crunch? Next slide. Okay, so some of our strategies here. The biggest thing, and again goes back to Chrys, having a plan. So making sure that you're going in thinking about what it is that you'd like to accomplish, and also having meetings with the important stakeholders on campus and the students, finding out, what it is that they need, so that way you can form something that's specific and measurable and actionable. Knowing just the Title IX and 129B requirements. So what are the institution's obligations? Are there areas where you can align? your agency's mission with the compliance needs of the campus. Tapping into competition or some of that benchmarking. So finding out what other campuses and other people in these advocacy positions are doing. Is a neighboring campus using a program or working with students in a way that would serve this institution? If there are some of those concrete results and outcomes that you can point to and talk about and, you know, kind of take a template from another school or another advocate, it's going to be that much easier to implement. So utilizing your relationship with the state troopers. So this is something where I found that it's much easier to kind of get together than to try to duplicate services, because often, you know, I find that with the investigator I work with, we have some similar goals. So at times like orientation, we will come together and do a presentation to the first-year students. Going door to door. So I feel that it's really, really important to just get out there and meet some of these people on campus. So if you're in the position where you can go to the campus or you have an office on campus, you know, start going around to the Health and Counseling Center, to some of the administrators, faculty, staff, students. Introduce yourself, give them materials, you know, explain what it is you do and what you could do for them. I found that once somebody sees that I actually, you know, have a face and they put that face to the name, they're more willing to refer somebody, and the referral process goes much easier. Are there any academic departments that align with the mission? Are there ways you can partner with professors, whether that's to teach a class, to hold events? Some of the different administrative departments and staff departments, orientation, residence life, student activities, these are all really, really important for some of the training and onboarding, and also to give that training to some of these student leaders who may be first responders to these situations. Student groups, so we're thinking of some of the high risk, right, particularly Greek groups, student athletes, some of the advocacy groups. Again, are there opportunities for trainings, collaboration? Next, looking at the upcoming campus events. You know, are there natural fits for your organization there? Things like Purple Week, Teal Week, campus safety fairs. And then lastly, to make sure you're getting your information out there in meaningful and also redundant ways. There's a lot of noise when it comes to campus advertising, and your information could get lost in the mix. So thinking about, do I have this posted in multiple places? Is it in multiple mediums? Are we getting messages out to students at different times throughout the semester and throughout the day? Next slide. Okay, so I know that was kind of a whirlwind to go through. So I just wanted to lastly talk about persistence. And I put this quote up there just because I know that this is kind of a lot to think about, a lot to potentially do. And it's going to take some time to, you know, figure out the collaborations and get acquainted with an institution. And it's so important to remember that even though this can be very slow going at times or feel that way, it is very, very important. And the reason we're working together is to hopefully prevent violence and to provide more options and the best service possible to our campus communities. All right, so that is all I have. Again, I'll be on the question and answer period, and then please feel free to email me individually if you'd like to chat.
Thank you so much, Angelica. Great. So before I introduce our next speaker, I'd just like to recap. So Chrys Ballerano from NYSCASA talked a little bit about collaboration techniques, the mindsets that we need to go into building collaborative partnerships, and the different administrative and logistical questions that we also need to answer for ourselves. And Angelica built on that by talking a little bit more about how what strategies she's using to work with the college in her area. And now I'm really excited to introduce Lindsay, Chrys, and Amuse, who is the director of the Sexual Assault and Crime Victims Assistance Program at Samaritan Hospital, who will tell us a little bit more about the work that she's doing. Lindsay.
Hi, everyone. I just want to thank you all for participating in the webinar, and also to Michelle and all of the wonderful presenters that have come before and will come after me for letting me be part of this. I want to preface everything that I'm going to talk about by letting you know that I am not the one doing all of this work. Really what I'm sharing with you today is the work that's done by my really amazing and remarkable coworkers who work in our program. There's a number of people at our agency who are part of the Enough is Enough contract and Enough is Enough work. And just historically as an agency, we've also, even prior to funding from Enough is Enough, we've had very strong relationships and we've done a lot of work with the colleges. So a lot of the things that I'm going to be talking about are really things that have built upon those relationships that were already in place. And then as you'll see, I'm going to talk about a few new things that we've taken on as a result of all of this new focus on sexual assault and other issues on college campuses, as well as the Enough is Enough funding. So you can go to the next slide, Michelle. So I just wanted to give you a brief overview about our program, because I know that while all of us rape crisis programs in New York State are doing similar work, I also recognize that many of us are part of different types of systems or have a little bit of a different focus. So just so you have an understanding of us, we're a comprehensive crime victim program. So we're working with individuals who are victims of all different types of crime, but we are also the dedicated rape crisis and sexual assault provider serving Rensselaer County. And for those of you not familiar with Rensselaer County, we're part of the Capital Region in upstate New York, so we're right across the river from Albany. And we kind of border on Massachusetts and on Saratoga County and some other counties. So we provide a lot of intervention services. We have 17 people on our staff. We do a lot with short and long-term therapy and counseling, offer lots of different kinds of support groups. We also are part of a hospital system, so we have consult services within our system. And just like all of you do, we provide medical accompaniment and criminal justice and family court accompaniment. And then we also have a large education component. And I'm not going to be talking much about our educational efforts, but I did just want to say that as a result of the Enough is Enough grant and funding, we do have a number of our prevention educators who are working specifically with college campuses utilizing various primary prevention programs. Our favorite that we use is Mentors in Violence Prevention. So Michelle, you can move to the next slide. Thanks so much. So I'm here today to talk more specifically about the direct services that we're offering right now to college students. And specifically within that, the services that we provide on campuses. So in our region, in Rensselaer County, we have 4 institutions, all of which are extremely, extremely different. We have a large university that is very, very focused on the sciences and technology. We have a more technical school. It's a school of nursing that's affiliated with our system. And then the two that I'm going to talk about most specifically, one is a small liberal arts school, and the other is a very large community college that's really commuter-based, and it's part of the SUNY system. So we actually have staff that are located on campus during the week, both of which are in the wellness centers of the 2 schools that I'm going to talk about. So at the Sage Colleges, which is located in downtown Troy, we have one staff person who's there for about 1 day per week, and then another staff person who's there for about a day and a half to 2 days. And we actually are so fortunate we occupy a space in their wellness center, which is their combined health center and counseling center. And what we've really done historically as a program for all of our services, but especially with these college services, we've actually sat down with the colleges and universities and we've said, we know you already have a lot of services on campus. What can we do to help you? How can we help you to fill in the gaps? That way we know that we're really meeting the needs that they're identifying and that their students are identifying. And also they know that we respect that they already have a lot of services on their campus. And every school is so different. So that's the way that we've really, we've kind of started to build those relationships. So this, particularly at the Sage Colleges, this staff person on campus really came out of a need that the staff were identifying from their wellness center. They were telling us that there were a lot of students coming to them who were reporting issues with sexual violence and intimate partner violence and stalking, and that while their therapists were very well trained in certain areas, they probably needed some help and also just had capacity issues with serving the needs of all of their students that were coming to them. So we said to them, we would be so happy to house one of our therapists or counselors at your location. And so we've been doing that for a while now, and we've been able to increase that the amount of time that we're there because of the Enough is Enough funding. So we also offer support groups on their campus. We're going to be starting that this upcoming semester. And all of the support groups that we offer at our main offices are also available to college students. In addition, we set up a referral system. So referrals for those services that are provided on campus come from a variety of sources. Obviously, we have the opportunity to do in-services with staff that are at the Wellness Center, so they're medical staff and also mental health providers. But we also have strong relationships throughout the school with faculty and other staff and members of the administration. So we receive referrals to provide those services specifically from those individuals who are on the campus. We also, of course, do outreach and educational and awareness events within the campus itself, so we're hoping that some referrals come from students. But what we've really tried to do is just saturate everyone on the campus with information about our services and the availability of them within their wellness center on campus. And then another component that we think has been very important in getting the word out is that we actually have staff who staff those hours at the Wellness Center, attend educational events at the school. So as I mentioned before, we do a lot of prevention education with colleges, but even if we're not the ones doing the presentation ourselves, we are asked to be part of the event and to be there in case a student is triggered, or even just to be there to say, hey, we're here, if something that you hear tonight or today strikes a chord with you, or you have a friend who you think could benefit from our services, here's a warm face to kind of tie to that service. It also gives an opportunity for people to come up and talk to our staff afterwards. So we think that's been a really important component of these direct services. And then the other school that we're actually physically on their campus for dedicated hours each week is the Hudson Valley Community College campus. That's also located in Troy. And we're there about one day a week, and it's the same day and time each week, so students know that they're able to access our services if they need them. And in that location, we're also in the Wellness Center. So it's that same idea that referrals for services will be coming from medical and mental health staff within the Wellness Center. But as I mentioned before about our prevention ed, we also have a lot of prevention education efforts on campus, so we're really able to saturate that campus as well. And again, that arose really out of a need for the availability of specialized services on their campus. And one really important part of our program that we've always taken to heart is that we need to meet our clients where they're at, both emotionally and psychologically, but also physically. So for college students who are so busy and some of whom may have transportation issues, it really does make a difference to actually physically be there on campus, and that really assists with them being able to access our services. And I wanted to talk a little bit about confidentiality. So we function on their campus in the same way as we function off their campus as certified sexual assault counselors with that level of privilege in New York State. So we have an understanding with those schools that while we're there on their campus providing services, we are not going to be sharing information with anyone from their school about that client's services, of course without written consent to do so. So we go through the same steps that we would if we were seeing a student here at our main office, which is to sign service agreements, to outline our confidentiality, and to explain to them that while we're providing services on campus, we are not going to disclose pertinent information to the school. Obviously, if there was information about self-harm or concern that someone was going to harm someone else, we would break our confidentiality. but in most circumstances, we're not sharing that information, other information with the school. So I think that's a really important component as well. So we can move on to the next slide, Michelle. Sorry that I can't do it myself. So now I'm going to talk a little bit about two other innovative services that we've been offering to college students since the Enough is Enough grant has started, one of which is funded by the Enough is Enough grant. So we have been offering support groups for college students for the past about year and a half. And so one of my coworkers, Jamie Seastrand, she's the main contact. She's on our staff here, and she started this group because we kept hearing from college students that were coming to us, I really wish that I could connect with peers who have gone through similar experiences. And we feel that it's really important as part of the healing process to connect with people who understand what you've been going through. So we actually have been holding a group here at our main offices at Samaritan Hospital once per week each semester. And it's open to students not just from the local schools that we work with, but from throughout the Capital Region because there's nothing else like this that's been going on in our area. So it's co-facilitated by Jamie and another one of our therapists. Various people from our program have worked on it. And as I mentioned, we've really opened it up to everyone. And it's been so successful that we've received some feedback from students that they'd really like to bring it to their local campuses. Particularly, we're going to be starting it at the Sage colleges in the spring. And that will also be co-facilitated by Jamie and another one of our therapists. And we're really excited because it's going to allow us to, again, literally meet the students where they're at in terms of their geographic location. It's been really interesting to watch the progression of this group, and even though there's been so much need for the group and so much interest in the group, it's very difficult for students who are so busy and, again, might have transportation issues to commit to and continue to participate in a group. So we really hope that bringing it to their campus will help with retention rates. But we're excited about that, and I'd encourage you to contact Jamie directly if you have questions about that group. And then lastly, actually the next slide is just a flyer for the group in case you wanted to see the type of information that we're sending out. And if you have an interest in starting a similar group, you're welcome to take any of this language. We're happy to share all of our resources. And then lastly, I wanted to talk about a really interesting program that my coworker, Mike Fonda, has been working on with the Sage colleges. And that is essentially a re-education program for individuals who are respondents. So individuals who were actually accused and found responsible for certain judicial conduct on their campus. So my coworker Mike has been participating in programming at the Rensselaer County Jail for a number of years, for about 3 years, and he utilizes the Mentors in Violence Prevention Program. He is someone who has a lot of experience utilizing that program and also has very close ties to the creators of the program. So he's worked closely with them to really develop that programming at the jail. And so some of the coworkers that we work with at the Sage colleges were made aware of that and came to us wondering if we might be able to tailor some type of program for individuals who were found to be in violation of certain, certain judicial conduct at the school. So what that has amounted to is Mike providing tailored programming to respondents who are found guilty of violating the student code of ethics. And usually it takes place in 4 60 to 120-minute sessions that is really meant to meet the specific needs and the specific issue for that student. So for instance, one of the students that he worked with was found guilty of inappropriate physical contact, so inappropriate touching. And so Mike was able to tailor the program to specifically address that issue. And what we found is that it's actually led to some really robust and interesting discussion with those students. And it's been much more effective, an effective way to reach them than simply having them sit through, a program like watching a video and having that be their kind of penalty or part of their re-education program. And so we actually contract with the SAGE colleges to offer that service, and we've been approached by a number of other institutions who are interested in pursuing that as well. Certainly, I would not say that that is the right path for every type of judicial violation. It's really ideal for the more kind of low-level offenses that still are inappropriate and still need penalty and still need re-education. But I would probably say that we would not engage in that type of education program with individuals who are guilty of violent assaults. But the type of approach is really, really valuable, and it leads to some really great discussion. So if you have questions about that program, I would encourage you to reach out to my coworker Mike directly, and I've provided you with his contact information. And just in general, I'm also happy to be a reference point, but I just want to again say that my coworkers are really the ones who have spearheaded these efforts, and they're the real experts in these programs. So I would encourage you to reach out to them directly.
Thank you so much, Lindsay. That was just so creative and so inspiring. We got a couple questions come in actually during your portion, so please continue sending in the questions, and we will address them at the end of the presentation. But right now I'd like to introduce our next speaker, Laura Plotkin, who is the Director of Training and Education at the Center for Safety and Change, and she's going to talk to us about how she engages campus communities. Laura, are you there?
I'm here.
Oh, excellent.
Hi, everyone. And again, thank you, Michelle, for having me on, and everyone for listening. So what I'm going to be sharing with you today is kind of just my strategy that me and my staff have been using. I don't like to pretend that I'm an expert in this. Just like you, this is new to me, and my staff and I are kind of trying to figure out strategies to make this a really successful program. And so what I'm hoping to do for you in the 15 minutes that I have is to kind of just share some of those strategies that have worked. Understanding that this might not work for everyone and that my county that I work in might look very different than the county that you work in. I'm down in Rockland County. It's about 25 miles north of Manhattan. We're the smallest geographic county in the state of New York, and we're tasked to work with 5 colleges. Just to give you some background information on our past relationship with those colleges, I'd say we have a really good relationship with 2 of them, really strong in the past. We have a pretty good relationship with one of them. One other one, very little contact, and then another one, which happens to be the Salvation Army, because they have a training campus located in our county. We've had no past experience working with them. So we're coming at this from colleges that we have a good relationship with and colleges that we've never talked to before. So I kind of have a good kind of gauge right now of what it takes to work with both of those. So we can go to the next slide. So the first thing that I would kind of say was a strategy for us was kind of identifying who our in was at the college. So in trying to figure out and strategize how we were going to approach colleges and get them to sign on to an MOU with us, we really had to figure out how we were going to do that. And our idea was that we weren't automatically going to go to the dean or to the president of a college. We were going to go to like lower level staff. So for us, this was staff that we've already been working with. In particular, we've had really good relationships with some of the mental health professionals on campuses and some of the campus security heads, as well as the Title IX coordinators. So for us, we kind of figured, let's go approach those people first and kind of get them to buy in to what we're doing. So if we can get them to buy in, then they'll be more likely to be allies and advocates for us when we're trying to get the MOU signed. So next slide. Great. So one of the strategies that really has worked very well for us is that when we sit down with those staff that I was just talking about, we actually created a short PowerPoint presentation. So in these small groups of staff, we kind of just wanted to introduce Enough is Enough as a program and what we can offer. We tailored every presentation, every PowerPoint presentation for that unique school, and really doing our research right. So we wanted to highlight all of the existing work that we've been doing and identifying gaps that I think would excite them. And what I mean by that is, I know that this school was previously, let's say, investigated for a Title IX violation 5 years ago because they were not reporting or they weren't whatever it was. So I can identify that that's definitely an area where they were weak on and where they might be really excited to get us on campus to fulfill one of those gaps. And that's different for every school. A school working, like the Salvation Army, who's never had us on campus, I kind of went in on the strategy of, well, are you actually providing these services? Do you know that you have to provide these services? So kind of feeling out where gaps were in what they were providing for students and offering to kind of take that off their plate so that we can provide that to them. Once I gave the presentation to the small group who seemed amenable to what we were doing and pitching, I then requested their help in setting up another meeting with what I would call, the decision makers on campus. So, okay, we've got the head of campus security, he's really on board with what we're doing. Let's now set up a meeting with the president or the dean of students and get them on board. And having the head of campus security able to vouch for us and what we're doing is a really powerful thing. Okay, next slide. So I just wanted to share with all of you this PowerPoint that we used in the initial meeting. And I actually gave the actual PowerPoint to Michelle. I believe she'll be forwarding it to you after the presentation. Please feel free to use that presentation, tweak it. It should just give you an idea of something that's been really successful for us. So I started with an overview of Enough is Enough, including all of the reporting requirements, talking about the Student Bill of Rights, the climate survey, and really pointing out that we can offer consultation and assistance with implementing these items. And, don't be afraid to kind of use what I'm calling the overwhelming them strategy. So saying, hey, you have all these reporting requirements, not just Enough is Enough, but Title IX and Clery and the Campus Saves Act, and let us help you. Let us take some of that off your plate. We want to fulfill these requirements for you. We also talked about what we can offer through the grant to them, including our new staff position, which we named the Coordinator of Campus Services, and really talking her up and saying all the things that she can do, and I'm going to talk more about those things. Again, also highlighting existing collaboration between our agency and the colleges, including all the trainings and outreach events, all the consultations that we've done, the direct services that we've provided, that we've taken on a lot of interns for them, right? We've provided experience for their students. We hosted film screenings on campus with discussion afterwards. So really talking up for the campuses we've been a part of, in the past few years, what we've done there. And wouldn't it be great if we could just continue this relationship by formalizing that partnership? Okay, next slide. So one of the things that we started doing was we created and conducted a needs assessment. So a needs assessment went out to everyone I worked with at the colleges. So this needs assessment was really for us to figure out where their training gaps were or things that they would like to see. So training needs for students and staff, how often they'd like trainings, the topic areas they wanted, technical assistance needs. So did they want consultation with us on creating that Student Bill of Rights if they haven't already done it, or that climate survey? Technical assistance needs on, do they want more training on the adjudication process or how that works? Are there any barriers for students receiving services? So we wanted to know, so if a student were to come to our office or want to come to our office off campus to receive services, what's getting in their way? And, a lot of that was transportation. Are there language issues? Is there comfortability? Students are afraid of, people finding out. Would they like to see an online hotline because we don't have that right now? Would they think that students would use an online hotline, a chat, or a text hotline? So there's a way for us to figure out what's going to work best as we're formalizing this relationship. Okay, next slide. And then one of the things that I'm most excited about are these consortium meetings that we've created. So really the goal of the consortium meetings is to hold these meetings of the 5 colleges in our county so that they can really come together and share knowledge and experiences and what's working on this campus, what's not. For us as kind of the facilitators of this, what our experience has been. So the first thing that we did for setting up these consortium meetings is really to figure out logistics. So part of the needs assessment was to ask availability of staff to attend the consortium. So what's going to work for you? What day of the week? What's the best time? Are you willing to host? Does your campus have space to host? And how often they'd like to meet. Our campuses came up with quarterly, and we fully support that. We think meeting on a quarterly basis is best. Okay, next. So our organization sent out invites. We organize the meeting's agenda, and we facilitate the meeting. And really the ultimate goal is to provide opportunities for each campus to meet with other campus staff, to share best practices and policies, and to share opportunities for future professional development to support students and staff. So really, trying to figure out, okay, we have in our grant $5,000 of training funds. As a county, where do we want to see those training funds go to? What's our greatest need? Do we want a Title IX training? For example, in January, we're hosting IACP, and they're coming in and doing investigating Title IX complaints on campuses. And that was something that a lot of our staff, when we did the needs assessment, talked about wanting. So, what's been working best for you when you're doing adjudication? What kind of sanctions are you giving? What's worked there? What hasn't worked? So it's a way for us to kind of share what's happening in the county. We can organize awareness events and kind of have a unified presence in the county to combat gender-based violence. And next slide. So like I was saying, topics of discussion, sharing training and professional development opportunities, and to pool and share those resources, and really to start collaborative planning options. There's some grants that we couldn't apply for ourselves as an agency, but together with other institutions, we'd have a really good chance of getting as a unified group. And so these county consortium meetings is a really, I think, something I would really recommend to all of you if you haven't done something like that in the past, and it's certainly been a really successful thing for us. So I think that's all I have. Yep, I talked about that. Great. Thank you so much.
Thank you, Laura. Excellent. Great. So we are actually right on time. So thank you so much for that. I'd like to introduce our last speaker of this webinar. It is Christy Waldron, who is the College Advocate Coordinator with Restore. Christy, are you unmuted?
I am.
Perfect. I'm so glad it worked out. Okay, take it away.
Thanks so much, everyone. Good afternoon. I am from Restore Sexual Assault Services. We are a program of Planned Parenthood of Central and Western New York. We cover 5 counties, Monroe County, and Genesee, Livingston, Orleans, and Wyoming counties. And through our 5-county region, we have 9 campuses that we collaborate with. And like many of the amazing presenters before me, we do many of the same tasks with the colleges, education, direct service work as well. But today I was asked to speak a little bit about using a rape crisis advocate in the student conduct system. So you can go ahead and change the slide. Thank you. So one of the things to keep in mind first and foremost is some campuses have advisors, what they call advisors, and some have advocates. One of our campuses in particular has both, and the main difference between the two, an advisor is to be a potted plant. So when you are advising a reporting individual or a victim through the student conduct process, an advisor is not to speak through that process on behalf of the victim, but they can, write notes, ask for breaks if you have questions that are going to take a little bit longer. Then you could just whisper back and forth or through a note. That's kind of the role of an advisor. An advocate at one of our campuses does have a speaking role. The students, though, do need to, at that one particular campus where there is both advisors and advocates, they do need to choose one or the other. But in general, so it's important to know up front when you're working with your colleges, what exactly your role is going to be if you're asked by a student to accompany them through the student conduct process. But overall, our main role obviously is to provide support to the students, to the reporting individuals, to the victims who are going through the student conduct process, to check in throughout the whole process. And I'm going to be talking a little bit in a few minutes about our referral process, but from when a report comes in all the way to the hearing, through the hearing, and from the outcome and beyond, checking in every step of the way. And the reason it's important to do this is it can help you address any concerns or needs that your client may have while they're happening in real time. So if you're noticing that maybe a college is doing things for the accused student that they're not doing for the reporting individual, or maybe your client just has questions about the process and how something is going to work, it's always better to address those along the way and not wait until the end when maybe there's an outcome that they're not satisfied with, and then if nothing has been addressed all the way through the process, that outcome at the end that they're not happy with sometimes can feel compounded and worse by the fact that maybe things weren't going the way they hoped throughout the entire process. So it's very important to check in every step of the way, ask questions. A lot of our schools will, if we're named as the advisor for students who are going through the conduct process, we are CC'd on any formal notification to the students about, whether or not something's going to go to a hearing, whether or not they have to come in for another statement, and what the outcome is going to be. All of those meetings, we're CC'd in on all of those things. So that really helps us keep our clients in the loop, and we can really advocate between them and the school. And then, of course, we, as an advisor, you want to prepare the student for the hearing. So one of the things that myself and my team does is we can go through the findings report. There's always a findings report that should be coming out with these cases, and we'll sit down with them before any, there's usually always a final meeting with the student conduct coordinators to go over all the hearing logistics and things like that. But I like to meet with the students before that to review the findings report with a fine-tooth comb. We check for inconsistencies that there might be, try to address those head-on so that there's no surprises or anything in the hearing. We can help them prepare questions because they do have the right to ask questions in a hearing. And then I'm always checking in to discuss the possible outcomes. What do you think, how do you think you might feel if the outcome isn't what you hope? And the earlier that you can do that and the more that you can do that throughout the process, a lot of times, again, I go back to that at the end, if it's not an outcome that your client was hoping for, hopefully you've already had some discussion around that and some plans and a game plan for how you might address that. So that's really our role as advocates, but advisors, and helping someone through the student conduct hearing itself, but really the process from when a report is made through the whole hearing. Next slide. Okay, so we have a referral process with a few of our schools, not all of them, where we're involved right from the get-go. So yes, you probably all know that students have the right to an advisor of their choosing per the law. So that literally means anyone. They can choose their mom, their dad, their boyfriend, their whoever, their roommate, can literally be whoever they want. So one of the ways that the schools, I don't know if any of you have been involved in conduct hearings where parents are involved. It can get a little tricky. So one of the ways where we're working together on this is the colleges will obviously let their students know that, yes, you have the right to whoever you would like, but it's really important to have someone who really knows our process and can help you through that. And they will refer them to Restore right away. And so that's a process that's really worked pretty well. It's imperative to have really good relationships with your Title IX coordinators, your student conduct coordinators and team, and campus police. Otherwise, it's tough to, I think I heard someone say earlier, kind of out of sight, out of mind if you're not on campus. Sometimes the referrals don't flow as much as we would like them to. So having constant communication and contact with your Title IX coordinators and that whole team, anyone that's going to be responding really, is really important to building this type of referral process to where they are automatically thinking of calling you in right from the get-go. So about that, automatic call-outs. Similar to, I'm sure, what many of you have with your local hospitals, where, someone presents, reports a sexual assault, and you're automatically called. We know that it's more likely that someone will use our services when we are the ones explaining our services. So it's not that anyone on campus is explaining it wrong or anything like that, but we just know that, victims have a, this idea that, they don't want to trouble anyone else or anything like that. And so if we can be there from the get-go, that oftentimes they're more likely to use us. And so what we have in most cases, now it doesn't always happen this way, but in most cases when a report is made, they call us at Restore. Sometimes it's, as a crisis situation, but most often the Title IX coordinator is setting up these meetings. And so they're able to say to us, hey, Tuesday at 3 p.m., so-and-so's coming in for a report. Can you be here? And so we will show up. We will explain our services, not only all the services that we offer to anyone in the community, but our services specific to what we provide on campus in the student conduct role. And we will explain those services, and then we will say, we can stay or we can leave while you're making your statement here today. More often than not, I don't think I've actually had anyone ever turn me down. The couple clients that I have had that have turned me down, I stayed that day while they were making their statement, but they already had someone in mind for who they wanted to use as an advisor, and that's totally fine. And we tell them that really throughout the entire process. Sometimes things change, accused students lawyer up, and so then the victim is feeling like they want a lawyer as well. And I tell them throughout the whole process, if at any time, you want someone else as your advisor, that's fine. I will not be offended or feel bad. This is really, all about what you want. And it really is important. I know a lot of schools don't have advisors come in until it's been determined that it's going to a hearing, but it's really important, we think anyways, to have someone available right from the get-go, because it increases that compliance when then the student is feeling supported right from the beginning, and then they're going to be a little bit more apt to work within the student conduct system. And then, of course, we can be a little bit more biased when the student or when the school cannot. We can say things like, I believe you, whereas the school has to stay neutral. So it's really important for students to be hearing right from the get-go when they're making a report that, they're being believed and all of those things that advocates can say. Next slide. And then to follow up with that, collaboration on policy. So what's been really helpful, I think, and what our colleges appreciate is that because we've been involved in their process, their student conduct process, we've been able to give feedback on the process itself and what that looks like and how it made students feel. And out of that, a few of our schools have even changed some of their policies or added things in. For example, I go back to that. One of our schools had it in their code of conduct that an advisor is assigned when it goes to a hearing, and since then they've changed it to state that an advocate or an advisor is assigned right from the beginning. So that's an example of one of the policy changes. If you can get on their sexual assault prevention education, sexual assault response teams, or case reviews, that is always helpful as well and can help drive policy change. And then it's already been talked about today about knowing about the legislation. The only way, the colleges are going to be more comfortable working with you the more you know about not only 129B, but also Title IX, VAWA, all of that. They're going to be more comfortable working with you if you know what they're expected to do and kind of what your role is on campus as well. And then being open to cross-training, that's one thing. Our colleges have been really great. They've had us, a couple of our schools have done mock hearings for us, and that has really helped us as advocates, learn what their process looks like, and we're able to better help their students. And so it should really be a two-way street, and training should be not only can we provide them with training on things like victim psychology and things like that, but how can they help us as well? And that's written right into a lot of our MOUs and policies as well. So that's what I had for my portion.
Great. Thank you so much. Christy. That was really insightful. We're definitely looking forward to 2017 when we're going to have a more in-depth webinar on the conduct hearing process. So stay tuned for that. Okay, so it is time for us to move into our question and answer session. And just before we do, I'd like to ask everyone to take a quick poll. The answers will be kept private. We'd just like to know how you felt this webinar went so we can continue to plan more webinars in 2017. So I'll give everyone a moment to do that. And as you're doing that, please make sure you continue to send in your questions. We'll begin that shortly. All right. Thank you so much, everyone, for sharing your thoughts on the webinar. So now we'll officially move into the question and answer session. So I'd like to ask for Nastia to give me some help so that we can start this conversation. Nastia, are you unmuted?
I am. Hey, Michelle. Hi, everybody.
Hi. Excellent. So, Nastia, we had a good amount of questions come in. We had a lot of questions around confidentiality, specifically what information advocates should be sharing with colleges and what information are people sharing. So I'll let you start it off.
Sure. So it's a question that we've definitely been getting from a lot of programs, and I think it's been largely in response to schools when they do edit their MOUs with the legal departments, trying to get a lot of information about who's coming for a rape crisis, who's contacting students through the hotline, who's contacting the rape crisis program through the hotline or through a crisis line or email or anything like that. So the schools are saying that it's important to have this information for reporting requirements. But the way that I've been advising folks is if this is not information that you would usually share, because all the same laws of confidentiality, advocate privilege, and certainly if it's somebody you're counseling and working with, they absolutely do apply. So we will be having a webinar in 2017 in January that will look a little bit more closely with some legal help about tools and kind of how to say no to requests to breach confidentiality without completely stalling the negotiations process for the MOU. But essentially, aggregate information, if schools want to receive some aggregate information and you have a way of anonymizing that, that is absolutely fine. But at the same time, one needs to be careful, as a lot of these programs are so new, that a lot of times anonymizing something and making it aggregate is really difficult. If a school knows, for example, that only 1 or 2 students have used your services, so to kind of try and aggregate that out and give them any information apart from we are seeing X amount of students, anything about other issues is not really going to be anonymous and could be potentially harmful. I don't know if you have anything else to add, Michelle.
No, I think that sounds great. Any other comments from our presenters regarding confidentiality or how you have maintained confidentiality while having partnerships?
This is Lindsay. We actually specifically wrote it into our MOUs that we would be, and we were very clear from the start about that with the colleges that we work with, and we really haven't run into any issues with it.
Great. Okay, so let's actually move on to the next question that came in. This is surrounding conversations that we've been having around meeting the needs of commuter students and students who attend a two-year university. So can we just brainstorm as a group with Nasia and the participants about how best to meet those students, speak with those students, and address them? What have you seen that's worked, and what have you tried?
So I've seen, I know that different schools have different rules about postering, but if possible, postering, flyering, and sharing resource leaflets in the student center or in places where even commuter students will be regularly, like classroom buildings, the student center. Honestly, inside classroom doors really works because folks are taking a hot second and will actually read from the poster. And the kind of flyers that can have little rip-down slips at the bottom with the contact information or email. I've seen that really work with commuter students, and also thinking about what kind of transportation they're taking. Is there some sort of, like I know some schools have like a bus that everybody always takes. Is there a way that you can include something there? And obviously email blasts are a way to reach everybody, but so many students don't read their emails regularly and get bombarded with so many emails that I think having something visual, if possible, is best. But also kind of going back to what some of you folks were saying about connecting with professors and academic departments. That academic departments could send that out in their listserv, and students are much more likely to read that coming from an email that they know. Professors could mention these resources just in 2 minutes at the start of class, or maybe give out flyers, something like that. So a way to reach students where they already are rather than expecting them to come to you.
Does anyone else, any of our presenters, have something they'd like to add about strategies they're using to address commuter students?
It's a tough one.
It is a tough one, and actually it's something that we at NSCASA as well as the Alliance are working on putting together some resources and best practices. So definitely stay, looking at the emails that we send, and hopefully we'll be able to develop a resource list that you could employ in your own work. So the next question I'd like to bring up, and one that I think is on the forefront of a lot of our minds, is how can we meet the needs of both students, both the respondent as well as the student victim and survivor. The reporting student. Thank you, Chrys. How can advocates meet both party needs, and what would that look like?
So I think this is a difficult one that has been an unforeseen challenge to some programs to some extent, because Title IX so specifically talks about equality and equal access, which in many ways should and is interpreted as reporting student and survivor accommodations. But a lot of schools have now started saying, especially with kind of the 2016 newspapers constantly filled with respondents who have been claiming failed due process rights, to really focus on the respondents as well. And I think the biggest thing in terms of kind of intervention and prevention is comprehensive prevention education that is ongoing and that is creative and innovative and reaching different groups of students. So not focusing just on the incoming first-year class or the incoming transfer class, but also thinking about ways to be doing those trainings in the Greek community, to be developing perhaps a train the trainer module where you could train team captains of athletics teams who can then go in and train their own teams, to start making this part of the conversation and increasing community accountability and conversation around it. In terms of direct service provision, I think that is a lot more difficult personally, specifically because a lot of the programs are working off existing support systems and advocacy systems for survivors, and kind of developing a whole new approach, perhaps new software working with respondents is a big ask. So I think letting it be known that resources do exist, and perhaps working more with the Title IX coordinator in this sense, because oftentimes the school's counseling and psychological services might be able to step in more in this regard. And the Title IX coordinator also does often have a stronger relationship with that space. So I think robust prevention programming and continuing to talk about resources, perhaps when you're doing your prevention programming, that includes counseling and psychological services at the school if they have one, and the Title IX coordinator's office.
And this is Lindsay. I just wanted to add, I think that this is going to be really interesting to see how it progresses over the next few years. I know that we as a program have struggled with this because our expertise is in providing services to victims and survivors. So to potentially be stepping in to start providing services, beyond what I talked about, like our Reeducation Program, but to be providing services beyond that to respondents, to those students is challenging. And that's not necessarily the kind of counseling and therapeutic expertise that programs like ours throughout New York State have. So we need to start kind of ways to get that, build that expertise if that is something that's going to be expected of us as we move forward.
Great. Thank you so much for your comments, Nastia and Lindsay. So our next question, and this will probably be the last one, it comes from a Title IX coordinator. They want to know what the best way to identify community resources are. And before I let everyone else answer, I'd also like to just say that on NYSCASA's website, we have a online database of all the rape crisis programs in the state of New York, searchable by county as well as by zip code. So if you are looking to find the phone number or an email of someone to get in contact with at your local rape crisis program, you can check out NYSCASA's website, and we have that information there for you. But I'd like to let everyone else have a chance to speak as well. What's the best way to identify organizations?
So I think, Michelle, the NYSCASA resource is definitely a really wonderful one. And identifying by zip code, I think, is going to be the quickest way to see which programs exist in your area. One thing I would say is that we are getting similar questions from rape crisis programs, kind of at the exact opposite question, like how do we find the right schools and how do we get the schools to respond to us? So maybe checking out, similar answer to what we've been saying to some of the rape crisis programs, checking in with some of your coworkers. They might have contacts and relationships with community organizations that you could then mobilize and use to reach out to different folks through kind of a personal connection in that way. A lot of these programs I know have been reaching out, so double checking, maybe it was right at the start of the semester in September when things were super busy, to kind of make sure that you haven't missed any attempted communication from your local rape crisis program. But I think looking through some personal connections and also the NYSCASA website, a lot of programs have been starting up this Enough is Enough programming recently this year, so are in the recent process of hiring and training, kind of developing that programming, which is a really exciting time So I think definitely the right moment, especially now in the winter when things are a little slower without as many students on campus and with classes kind of in a pause unless there's a winter session, to really build these relationships, kind of start going through those steps that Chrys so productively outlined for us at the beginning. Thank you, Chrys. And start building those relationships and use this kind of lull to really do that. And even reaching out cold and then just setting up a face-to-face meeting, I think is a great way to get started, particularly at the start of 2017.
I could not agree more, Nastia. Okay, so actually that's all the time that we have. There were a few outlier questions that we weren't able to get to. I will make sure that you get your answers. So thank you very much for sharing them. And I want to thank our presenters and Nastia for sharing the work that they're doing, the work that their colleagues are doing, and the strategies that have worked well for them. This is absolutely an ongoing conversation, so please feel free to email Chrys. Her email information is above, as well as Nastia, to continue this conversation, ask additional questions regarding MOUs or collaborative opportunities and strategies, and we're happy to continue this. So thank you all very much, and have a wonderful afternoon.
Thank you, Michelle. Thanks, everybody.
Thank you.
Thanks, everyone.
Thank you.